I got the idea to help people with obsessive compulsive disorder. I happened to be sitting in a parking lot recently waiting for my son. And a car pulled up next to me, and I looked over, and the woman got out of the car, and she locked her car doors, and she walked away. She only got about 3 steps, and she came back again, and she checked the door handle. You know how you pull it up, pull it up? Well, she pulled it up 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And she walked away. And she came back again. She must have thought to herself, well, what if it's not really locked? And she came back and she tried it again. And she walked away a few steps. And she came back again and did it again. Then she went to the back door and she tried that again. And I thought, wow, this poor woman, she is a prisoner inside her mind of worry that this car is not locked and that, God forbid, she leaves it open, something's going to get stolen, someone will steal her car, she might have something in there, whatever it is. The fear of that happening caused her to keep coming back and forth to the car. She was stuck. She was stuck in the obsessive thought, the ritual performance, and the ritual was not giving her any kind of consolation that she was, in fact, fine. Eventually, she did it enough times where she walked away and she went on to see what she was going to, went on to do what she was going to do. But who knows what that number is, and that number gets higher and higher. Many times, family members will get involved to try to help the person. So they'll enable the situation to keep on going. This is called feeding OCD. And when you feed OCD, you just make it get worse. So rather than actually letting the person deal with the anxiety in some way, by you stepping in to try to help, you're in fact now enabling the OCD to get stronger. Now I just want to say that I'm not a therapist or a clinical psychologist or any type of a professional person. I just recognized something that I see people suffering with, and I did some research on it so that I could share it with other people who might find it beneficial if perhaps they have a problem with it or recognize someone that has a problem with it, maybe never even thought that that person has OCD, just thought that that's the quirky way that that person does something. Many people with OCD actually keep it a secret. They don't want anyone to know that they have OCD because a lot of the things that they do are strange. Some people are hoarders. They hoard things. That's a type of OCD. They're deathly afraid that if they throw something away, and most of these things are irrelevant things that you and I would consider just for the trash, they fear that they may need them, and so they save them. And their houses or rooms become cluttered with incidental, unnecessary things. And if you have a child that's doing something like that, it's not going to be, you know, their little stuffed animal or their blanket from when they were little. It doesn't have sentimental value. I mean, everyone does that. It's something of trivial worth that no one would keep, you know, like candy wrappers or something, and they'd have a big pile of them, and then you'd go in there and try to straighten up and vacuum or something, and they would go into a frantic attack that you've disturbed their things, and they'd either start counting them frantically, trying to get back to even with their hoarding. A person like that, you know, needs help to get over that hump. Now, the average age that a person gets OCD, actually, it starts many times in childhood. The average age is between 7 and about 12 years old, with the real average being about 10. And about 10 years old, people can look back and say, you know, I think that's where it began. And sometimes there's a trigger, an illness, death in the family, a big move, something triggers it. And next thing you know, you'll notice your child, you know, doing something different, washing their hands. Most adults that have OCD have it before the age of 25 and think back and realize that they had it in childhood. There's also some medical indication that sometimes OCD can be brought upon children by exposure to the strep virus. When a child gets strep throat, sometimes the virus starts attacking other areas of the body, like the brain. And when it does, it can somehow alter these serotonin transmitters, neurotransmitters that I mentioned to you, And because of that, OCD may develop. Now, that doesn't mean that every child that gets strep throat is going to get OCD. There needs to be, or it's usually a child that's predisposed to it. Maybe there's a family history of OCD. Many people with OCD have a family member or an extended family member that has the disorder, so it's in the genealogy, but that doesn't mean it's always that way. Sometimes people with no family history of OCD can come up with it all on their own. And don't think, parents out there, I know when something happens to our children, we think, oh my gosh, it's something I did or didn't do. No bad parenting, no amount of bad parenting is going to give your child OCD, just like no amount of great parenting is going to prevent your child from getting OCD. I mean, it's just something that happens, something triggers it, and usually it is there for good. With the strep throat OCD that's brought on by strep throat, once it's treated with antibiotics, very often the symptoms of OCD will subside dramatically. That's how you know your child has OCD, this OCD-related illness. It'll come on suddenly, violently with the OCD symptoms, and then as the treatment happens for the strep throat, it will wane the OCD symptoms. Whereas people who get OCD not from the strep virus will have a gradual onset of symptoms. You know, it'll start out smaller, some hand washing and some thoughts that are disturbing, and then it will sort of collect itself to getting bigger and bigger and bigger. So how do you get diagnosed with OCD? Well, the way you get diagnosed, obviously, is by a clinical psychologist or therapist that you might want, you want to take first a look into that and have your therapist, they evaluate the behaviors of you, if you're the person with it, or the loved one, and then they'll form an opinion. And there are two ways that obsessive compulsive disorder are usually treated, and they've had the most success with these ways. And one of those ways is with medication. Certain antidepressants that deal with serotonin are helpful in treating OCD. Many times they're used in conjunction with what's called cognitive behavior therapy. So these two things, medication, one thing, and cognitive behavioral therapy is the other thing. In hand, these two things can work to help a person with OCD. Now, you may not want to use medication. You may want to try to do it without the medication. Well, then you can try just doing the cognitive behavioral therapy and see how that goes for you. They've had great success with it, and the good thing about that is it lasts longer. Obviously, medication lasts as long as you take it, and hopefully you get, through the work that it takes to try to relieve yourself of these symptoms, and then you'll have to keep on going with the cognitive behavioral therapy. And the cognitive behavioral therapy that's used to deal with OCD is called exposure and ritual prevention. Now, exposure and ritual prevention is about letting the person feel the anxiety and not performing the ritual to make themselves feel better. What a lot of people with OCD don't know is that if they just waited long enough, the anxiety will pass. Our bodies are designed to do what's called habituation. And habituation is adaptation to something that's different, new, whatever it is, even an anxiety. So when you go into the darkness and, you turn off a light in the room and there's complete darkness, well, at first you can't see. But then you can. You can see shadows and you can see figures. It's the same kind of theory. Your body has now adapted to the darkness. Your eyes have adjusted. This is the same kind of thing. They have to adapt to feeling the anxiety and not trying to immediately, with a short-term solution, which is what the ritual is, the compulsion, without doing that ritual, let them feel the anxiety so that they can face the fear. And that's really the only way a person can try to get over the OCD.